Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm here with Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we are announcing 14 additional deaths related to COVID-19. A female in her 40s from the Winnipeg region, a male in his 60s from Southern Health Santé Sud, a male in his 60s from Winnipeg region, a male in his 70s from the Winnipeg region, a male in his 70s from Southern Health Santé Sud, a female in her 80s from the Winnipeg region linked to the St. Norbert Personal Care Home, a female in her 80s from Winnipeg linked to Golden Links Lodge, a female in her 80s from the Winnipeg region linked to St. Norbert Personal Care Home, a female in her 80s from Southern Health Santé Sud, a female in her 80s from the Winnipeg region, a female in her 80s from Southern Health Santé Sud linked to the Rest Haven Nursing Home, a female in her 90s from Southern Health Santé Sud linked to Rest Haven Nursing Home, a female in her 90s from the Winnipeg region linked to the outbreak at Bethania Mennonite Personal Care Home, a female in her 90s from the Winnipeg region linked to the outbreak at Charleswood Care Centre. We extend our condolences to their family and friends and caregivers. Again, these are tragic days for Manitoba. We again continue to list these lost Manitobans daily, and we all know we need to start bringing these numbers down. We can't continue with these daily numbers. Our current 5-day test positivity rate is 13.2% provincially, 14.5% in Winnipeg. 277 new cases of the virus have been identified as of 9:30 a.m., bringing our total to 17,384. We do see our numbers again stabilizing. They're stabilizing at a number that we still can't sustain, so we need to continue our hard work to bring these numbers down. We can't rest at these numbers, even though we've seen some minor improvements. Our case numbers are still high. We still have too much strain in our ICUs and hospitals. And too much strain on our healthcare professionals. So again, the message is to stay home, go out only for essentials, send the least amount of people outside of your house to get those essentials. Employers, continue to work with your employees to find ways to work from home if possible. Also look for ways to make the workplace safer, decreased crowding, using physical distancing, masks, lots of hand hygiene, ensuring your employees can stay home when ill, that they can stay home when advised to self-isolate. This all requires us to work together. We need all Manitobans to step up at this point to work together, bring these numbers down. And so we know from our hospitalization numbers, including those in the ICU, we have too much strain on the healthcare system. We've had to scale back on elective procedures to be able to expand our capacity to deal with these new COVID cases. So we need to bring these numbers down to ensure the healthcare system is there for everyone, and to reduce that strain on our healthcare workers and to reduce the severe outcomes that we continue to see here daily in Manitoba. So thanks again. Thanks for trying to all work together at this. Please stay home as much as possible, and I'll pass it over to Lanette.
Thank you. Good afternoon. This morning we had 351 individuals in hospital due to COVID. We are continuing to see people of all ages enter our facility, including the very young and the very old and people in between. Our critical care program is at 147% beyond our normal capacity, pre-COVID activity as of this morning. There are 106 patients who are in the critical care units, and 51 of those patients have COVID-19. We have 78 patients overall who are on ventilators, and 44 of those have COVID-19. Plans are in place to open up additional space within critical care, including 14 additional beds. New models of care continue to be developed and implemented within medicine and critical care areas. We aren't yet in a position to open up the lower acuity spaces, which we identified as the third phase of our capacity plan. However, we have teams in place who are working towards implementing if and when we need to do that. The site and spaces have been identified, and we are looking at the first focus of locations being sites, existing sites within healthcare facilities. The equipment and supplies are here in the city, and they are available whenever we need to put them in place. Work is also happening with regards to the staffing models for these locations, remembering that the people who will go to these low acuity sites will be non-COVID low acuity patients, often who are waiting to go to another level of care outside of the hospital. I also wanted to provide an update on the personal care homes. We know that Manitobans are watching this carefully, and so are we. There are currently 48 personal care homes throughout Manitoba who have identified one case of COVID, either with a resident or with a staff person. Some of those obviously have a higher level of outbreak. Regular physician coverage and medical monitoring of all residents continues, and it's either provided on-site or virtually. Clinical leadership has been assigned to some of those more acute outbreak sites. Care homes throughout the WRHA region continue to access the community IV program, the palliative care program, regional infection prevention and control staff, as well as respiratory therapists going on site to support the patients. We have the Canadian Red Cross now in Manitoba. They are providing infection prevention and control assessments and guidance, as well as they are on site assisting at the Maples, Golden Links Lodge, and the St. Norbert Personal Care Home. The Red Cross is also planning to provide some staffing support in the days ahead at Holy Family. Again, that will be focusing on infection prevention and control assessments and helping the staff providing guidance. The health regions also have access to the emergency response team to provide short-term intervention during high acuity situations. Currently, there is the paramedic support at Fairview Care Home in Brandon, with one paramedic on site 24/7, as well as at Grandview, there's one paramedic on site during the day. And finally, we have students at Red River College who are currently enrolled in the micro-credentialing course for uncertified healthcare assistants. They will be graduating, I believe it's next week, and they've been hired into the system. They will be completing the course next week, and they will be deployed to personal care homes, as well as we'll be starting another course right after that at Red River College. I also want to provide an update on the isolation centers. In Winnipeg, we were able to open up the 138-room site, which is fantastic. It gives us a lot more flexibility to find space for clients who are waiting for their test results or are isolating because they don't have another option. Many of these clients are our shelter population. They are experiencing homelessness. So it's a good opportunity for us to support them and support the community and mitigate the spread of this virus. The first 2 clients were welcomed into this new site recently, and we have 15 more who are expected to arrive today. The hotel site had 53 rooms in use yesterday. Our Red Cross partners, who also have a hotel site, had 131 clients. Both sites are very near capacity, but they continue to have flow of patients coming in and patients going out. They work together as a group and make sure that isolation needs are met for Manitobans who need it. In total, we now have 14 isolation sites across the province, with 9 smaller sites situated throughout the north so that residents can isolate closer to home. There are 74 people isolating currently in these northern isolation sites, while another 21 northern residents have been transported to Winnipeg. There are also plans to open up the Brandon isolation site in the coming weeks. Healthcare workers, as you know, are at the center of our COVID response. And for nearly 12 months, they have been battling this pandemic and supporting patients, supporting each other as teams. And we are very happy about the agreements that have been reached in the past 24 hours to support the work that they do. The Manitoba Nurses Union, this agreement will allow us to redeploy nursing staff to higher areas of priority, including personal care homes, intensive care units, and designated COVID units. The agreement reinforces our efforts to increase and stabilize the workforce that is supporting the needs of patients and residents in these priority areas. And it also recognizes the dedication, commitment, and sacrifices of our nurses who are caring for our sick and our most vulnerable patients. This benefit also applies to those adapting to changes in duties or work location as needed to provide care. Similarly, an agreement with Doctors Manitoba recognizes the commitment and dedication of our province's physicians and the vital role they play in the health system. The agreement announced yesterday will provide compensation to physicians who are required to miss work because of a COVID diagnosis or confirmed exposure. This agreement builds upon a measure already in place for healthcare workers who since the spring have been paid in full as if placed on administrative leave due to the possible workplace exposure to the virus. And finally, just a quick update on HealthLinks. They have been working really hard to keep up with the demand. The calls continue to be around 2,000 per day, and the COVID-specific calls are becoming more complex, taking more time, and they've been making sure that they can staff up accordingly and meet the demands. So as of last week, yesterday's wait time was only 14 minutes, which is a huge improvement from where they are, and that is thanks to the leadership who's been helping, and also to the new recruits who have come on board and are learning the ropes and answering the calls and working very collaboratively to get the work done. So with that, I think we can open the line to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from Global, Malika.
Hi, thank you so much. It's Malika from Global News. Dr. Roussin, this question is for you, I believe. We got an email from someone asking about non-essential and essential items. One of the items on the list, a person was trying to buy a pair of scrubs as they are a healthcare worker and was not allowed to buy them. Can you please explain not at this point, or if that list is going to be changing when things like this get flagged?
Yeah, well, we have changed that list already. We we know that it's complex. A lot of our orders, we try messaging first, right? And so we tried to advise Manitobans to stay home, to only go out for essential reasons. We tried the approach of having only stores that would be open to sell essential items, but then we saw that these big box stores were very busy with selling the non-essential items. So we needed to come up with some sort of list, and we know it's sometimes difficult. There will be, when you create lists like that and you try to be specific, there's going to be things that are in and things that are out. And so personal protective equipment, certain personal protective clothing is on that list. Scrubs, when we looked at that, and again, we still review things. These are available curbside pickup, available online. So it's not like these items can't be obtained. But at this point, they haven't made the list of essential items.
Okay, thank you so much. And our second follow-up question, wanting to know when lockdowns are lifted, will it be similar to the process as what happened in May, or is it going to be potentially a little bit different this time around when and if that happens?
Yeah, so it's I can't comment for sure on exactly what it'll look like. It's going to depend on what our numbers happen to be, how our strain on our healthcare system is. So we'll be reviewing all that, and then as we make decisions, we'll advise Manitobans again.
From the Brandon Sun, Colin.
Hi, Dr. Roussin. Yesterday, the Premier said that it was his gut feeling that COVID restrictions would be going on for a long time. Do you agree with that statement?
I think that where we are right now, where we're seeing our ICUs over capacity, our healthcare system is very strained, and December 11th is coming up quite quickly. So again, I can't advise on the specifics, but we're going to have some restrictions in place for for the near future, for the foreseeable future, because we can't sustain numbers like we're seeing right now.
We had a reader ask if it might be possible for the government or public health officials to provide information on what kind of locations and activities were the source of COVID cases, like going to fitness classes or swimming or going to church, so that people can avoid potentially dangerous situations by knowing where infections have happened. Is that something the public health might be amenable to start doing?
I mean, we've announced various concerning exposure events, so we'll continue to do that. We've provided information on a number of outbreaks, but and I think we'll still continue to try to increase that amount of knowledge that we share. What we know is that right now a significant proportion of the cases we can't tell where they acquired it from. That's the community-based transmission. So, the best thing to do are those fundamentals and to stay home. That's why we have these restrictions. As we tend to open things up, we'll provide information on where we're seeing or where we're thinking cases are being acquired. But we also have a lot of information from the literature and from around the world, and we know where those places are, and then they all have the prolonged close indoor contact. And so we know the settings that provide for that, and so we'll continue to keep that information flowing.
From CJOB, Amber.
Hi, I'm sure you guys have heard the Justice Center for Constitutional Freedoms has sent a letter threatening to file an injunction over the ban on drive-in church services, saying it violates their charter rights. Is the province considering changing the rules and allowing these drive-in services?
You know, we're always reviewing those rules. We know that these current orders expire December 11th, so we'll need to be, re-implementing some sort of restrictions at that point. So we're reviewing all sorts of issues with these current orders.
Okay, and we're seeing another day with new numbers of cases in the 200s, which is better than it has been. Are we seeing those numbers maybe start to point in the right direction, and is that maybe a result of the stricter restrictions?
Well, I think we've seen now for the last couple of weeks that the reversal in the escalation of the numbers. We're not seeing this climbing numbers like we said this week or next week. We were expecting to see 1,000 cases per day. Now we're seeing a very early indication that the numbers might be coming down, but it is very early. And it's been shown, throughout the world that these type of restrictions do have this effect. So we're certainly expecting the numbers to come down. That's the sole reason why we put these restrictions in place.
From the Winnipeg Sun, Scott.
Hello, good afternoon to you both. First question for Dr. Roussin. It used to be that transmission between two schools, outbreaks declared in schools, the transmission was between two or more epi-linked cases in schools. Apparently that's changed now. Now it's widespread transmission in school that crosses cohorts. That's now called an outbreak. Why make that change, and why was that change made silently?
Well, see, the definition of an outbreak depends on in the scenario. So public health uses this term technically for its own purposes. So we'll see in, say, a long-term care center will have a single staff, an asymptomatic staff that would tested positive. That's going to be an outbreak in that facility. It helps us organize our investigation and response in that area. Within schools, depending on the nature of the transmission, we may or may not declare an outbreak, just like we do in many other communicable diseases. The issue really here, or the non-issue, is we report all cases. Right, so whether we call it an outbreak or not, we report all cases linked to schools, so everyone can see if there's 2 or 3 or or if there's a link or not. So the public health will use the term outbreak when it's indicated for our public health investigation, but there's nothing that's under the table or quietly. We report all cases linked to schools.
Okay, thanks for that. Despite the lower cases in the province-wide, and I guess the test positivity rate in the province jumped slightly by 0.1%, but the Winnipeg one jumped by 0.7% today, and I think that's climbing in the last couple of days. What's still not working in Winnipeg that test positivity number is still so high?
Yeah, and so that's the goal is certainly see that start coming down. The day-to-day fluctuation of the test positivity, we have to be careful on it, looking at overall test numbers and things. So nonetheless, we did want to see that number lower than where it is now. Part of the reason for that is the nature of transmission right now in Winnipeg. It's widespread, it's community-based, it's also disproportionately affecting some of their lower income quintiles, disproportionately affecting areas where housing insecurity is lying. So the restrictions that we have in place, it takes much more time for that benefit to reach communities like that. So we're working on a number of things. You've heard about the alternate isolation accommodations. We have setting up some more testing approaches in that area. So we're still looking to see these numbers start coming down.
From CBC Radio Canada, Emily.
Good afternoon. I was wondering, regarding the redeployment of nurses, what are the biggest challenges when redeploying those nurses and from one service to another? Do they have a specific training? How how it is managed?
That's a great question. So our goal is to make sure that the staff get a proper orientation to the site where they're going. Ideally, that would happen before they get deployed, but it can happen in the moment when they get deployed there and they start their shift. They get an orientation, become familiar with the unit and the duties. It depends on what their role would be when they're deployed to a new site as an extender or as a primary care provider with the medication and the patient load or supporting someone else who does. So as much as possible, we make sure that we match the skills with the expectation. We want to make sure that nurses or healthcare assistants who go feel that they are within their competencies, so we don't want to push them beyond that. We want to use them for the skills that they have and make it a good, safe experience for everyone who's involved.
Thank you. And so, I'm sorry, maybe I missed this part. Is this, do you ask the nurse, is this a voluntary thing, or do they have to go and then it's an obligation? And do they have any other support that goes with this, like mental health support or anything like this?
Mm-hmm. So the first line would always be to ask and find volunteers. It's also about matching the right skill set with where we need extra resources deployed. So first the volunteer, and if not, we would say that we need you to go here. And as much as possible too, we want to have some continuity. So if people are being redeployed, say to a personal care home, that they go to the same personal care home and have a schedule that they can rely upon. Sometimes we'll send them with a buddy nurse from their home unit so that they have that support person built in. And as much as possible, make it as easy for the redeployed nurse to go and support the other team. It also depends where they're going. So in this memo of understanding with the nurses union, there is the potential to go region to region. So not just within the city and not just within the same sector, but potentially if people want to go up north, that would be an option too. Obviously, we would work with the individual and seek volunteers first. In terms of extra support, absolutely, we've talked a lot about making sure in this disruptive time that nurses, not just nurses, anyone who's being redeployed, physicians, we have clinical assistants, physician assistants, respiratory techs, but when they're moving to a new unit, that they definitely have time, rest time in between. We don't want to burn out our staff, as well as wellness checks and mental health resources that are available to them as individuals or as teams, just to keep the spirits up and make sure they're rested and feeling good about what we have to do, because it's a difficult, challenging time for our staff.
From CBC Manitoba, Bart.
Hey, Dr. Roussin. You just stated that all cases in schools are reported. With respect, that is, the reporting has been incomplete and delayed at best, as any parent will tell you. You can see discrepancy between what's reported officially, what's disclosed to parents, and what is out there on these citizen-led accounting spreadsheets. Furthermore, you're not testing inside schools. What would you say to the suggestion that the province has been trying to minimize the school spread so that you can limp your way through the remainder of this term?
Yeah, I would say that's not at all what we're doing. Public health, our main focus is the health of Manitobans. So we're not interested in limping through anything. We're here to protect the health of Manitobans and to ensure the right balance. So these restrictions are difficult. For most people, having our children in school, face-to-face learning is very important. So we'll do whatever we can to try to keep that moving. If you look at the overall proportion of cases, I mean, we have 200,000 students in schools. And so, of course, we don't want any cases in children. We don't want any transmission, but if you compare that to the overall population, you can see that it just isn't a lot of transmission going on in these schools. So we'll continue to monitor it whenever we feel that there's increased risk, like you've seen in the Hanover district, where not because of the transmission within schools, but the very high incidence rate out of it, then we'll act on it. So we're not trying to minimize anything. We try to be as transparent as we can, while at the same time protecting privacy. But we're here to protect the health of Manitobans while balancing overall health.
Thank you very much for that. Ms. Siragusa, we have heard a couple of things so far that are in the second phase of the COVID surge plan for hospitals, the opening of the Selkirk unit last week, the additional beds that you spoke again about today. What else? What other tangible thing in the second phase of the COVID surge plan can you tell us about that is transpiring or about to transpire?
Well, we're still working very much on the models of care. We are starting that work. We're not finished that work. We're looking at where the service delivery opportunities are, where we could maybe redeploy staff. We're looking at resources. We're looking at priorities. So within that second phase, I don't think we're so worried about space and equipment and supply. We're obviously worried about the staffing part. So it's really continuing to work through that and listening to the people, especially in critical care and medicine and the personal care homes. There's early lessons coming out where I think we need to adapt and evolve and learn as we go. So that's still ongoing, and that's going to be going on throughout this pandemic. But as we need to build upon the space, it's really working with the staff to build those teams. So that's the second phase. And then Bartley, the third phase is going beyond the hospital beds if we need to expand capacity so that we're looking at other spaces. That would be the next phase. Does that answer your question?
From the Canadian Press, Steve.
Oh, hi there. I was wondering why are test numbers so low? Our test positivity rate is high. The daily case count numbers are low. I see that we're now getting tests in the 2,000 to 2,500 a day range. That's well below the 3,000 plus we were doing a while back.
Yeah, so most of it relates on demand. All of our, or essentially all of our testing specimen collection sites are working at under capacity, so there's less demand for testing. Sometimes there's a little bit of a timing issue where specimens that were collected, sent that day to lab, haven't yet been reported out, didn't make the 9:30 time for that. But for the most part, our specimen collection sites are running below capacity. They are able to collect many more specimens than people are showing up for tests.
And secondly, can you reveal new projections that you have for early December based on the restrictions that have been put in place? You've previously, talked about the numbers that you were looking at had no restrictions been in place. But can you tell us what the demand might be on the healthcare system, what you're predicting in terms of new case numbers, ICU numbers, and deaths based on the restrictions now in place?
So we are going to be working on that. I don't have updated numbers on that. I think fairly soon we're going to try to have a presentation here on some of those numbers. And just to make it clear, the projections that we're seeing, sort of that 1,000 cases per day, they were projecting as if we had no restrictions in place, but we were actually in orange when we did those projections. So despite being with fairly significant restrictions, we were still trending as if we had no restrictions and no adherence to public health advice.
From CTV Winnipeg, Michelle.
Hello. We'd like to know how confident are you in Manitoba's ability to acquire enough doses of the vaccine once Health Canada approves one?
So, overall, the procurement and distribution of the vaccine is at the federal level, and so we definitely collaborate with all the provincial, territorial, and federal jurisdictions to look at that. But it's going to be really how much of this vaccine can be procured, and the timing, and how it gets distributed out to the region. So right now, we don't have a vaccine that's approved as of yet in Canada. Once that's approved, with all the things in place, certainly the plan is that any Manitoban who desires an immunization will be able to get one, at some point. How long that will be is going to be up to how much vaccine is procured federally. It's certainly not going to be within just the next few months. These next few months, if vaccine is approved and distributed, we're going to be looking at very short supply for the first few months, and expanding that as 2021 progresses.
Okay, thanks. The U.S. Centers for Disease Control is now giving alternate quarantine guidelines, so 7 and 10 days based on having a negative result and no symptoms. Given what we know about the virus now, would Manitoba Public Health consider doing kind of the same thing, or is it too risky?
Yeah, and so we're continuing to look at that. So right now, the isolation period for cases is almost always 10 days post onset of symptoms. And as long as symptoms are improving and they don't have a fever at that time. So a lot of the studies show that it's probably earlier than that for most, but we had that period of safety in there. And so anytime you shorten these things, it's a trade-off, right? The shorter incubation time means less impact, or shorter isolation time means less impact on that individual, and many individuals, and less impact on a lot of things, less impact on alternate isolation accommodations. And so it does have a benefit, but with it there's always that risk. There's always a few more percentage points of people who might be infectious after that. So it's all that balance on how much risk are you willing to accept with that. There might be chances of few more transmissions that way, versus having many more people comply fully and less strain. So we'll continue to look at the evidence. We look at other jurisdictions and see what kind of successes they're having. But this is something that we're reviewing right now.
From City News, Stephanie.
Hi there, Stephanie Lusuk with City News. Ms. Siragusa, just a quick question about the nurses' new agreement. Are testing site nurses left out of these new premiums?
That's a good question. I'm not sure. Certainly I'll have to follow up on that. I don't have that detail in front of me.
Okay, no worries. And then the MOA from back in March did state that nurses could be redeployed. So I'm just wondering, this new agreement, the way that it differs from the old one is strictly that it gives premiums for redeployed nurses?
Yes, there's premiums, and it also looks at the environment in which they're being redeployed.
From CHVN, Taylor.
Hi, good afternoon. What can Manitobans do right now, along with following the public health orders, to safely say thank you to frontline workers?
I think from public health, I think it's, I think we've seen a lot of examples of that, and I think it's really much appreciated by the frontline health workers. I do think, you prefaced it by that, but I do think that the biggest thing is to, to follow the orders, to support them, to show your support for why we're, sacrificing right now. And that's from from the public health perspective, and I think most Manitobans are, and many are showing overtly their thanks to the healthcare workers who are at the front line. No, Lanette, if you wanted to add that.
Yeah, I would agree that the best thing you can do for healthcare workers is to follow the public health guidelines and wear your mask, stay home, wash your hands, and help us to get these numbers down.
And we're hearing and seeing a lot of Manitobans right now who are doing good this season. From both of your perspectives, what's it like to see people find ways to still show love and kindness despite the lockdown?
Yeah, I think that's the key to this, right? That no matter what restrictions we have in place, we are definitely all in this together. And so actions of all Manitobans, affect us all. They'll affect the hospital numbers. They'll affect the health of others, and there's just no way around that. So for people who are, struggling, this is a long 9 months, and for some people it's caused a lot of issues, be it financial or with their health or health of loved ones, and so to still find that positive outlook, to still find ways to try to keep Manitobans on board with this. And it's going to be even more important as we get into what's going to be a very tough and very different holiday season. So really, appreciate that, and that's also leadership. Manitobans who are doing that are showing leadership to try to bring down these numbers.
From the Winnipeg Free Press, Danielle.
Good afternoon. Dr. Roussin, what are your thoughts on pursuing the so-called COVID zero strategy or aggressive suppression tactics of the virus here in Manitoba?
I'd say that being in a pandemic is challenging, and I think we have to accept that we're going to see cases of COVID-19. We can see right now with these restrictions that we have in place, which many Manitobans are vocalizing their discontent with having any restrictions, and many are saying that these restrictions are going too far. These restrictions will not get us down to zero cases. Our intent is to get these numbers down to an area that doesn't overwhelm our healthcare system, reduces community transmission so we can better protect those most vulnerable. But the goal of these restrictions isn't to get to zero, because these restrictions won't. We would need much, much more stringent restrictions, and really they would have to be in place for months and months and months. So I think the better approach is to have a real control on the transmission, get these numbers down so we can do very urgent case identification and contact tracing and protect those most vulnerable.
Thanks very much. And then I guess as a follow-up, given our experience heading into the second wave and where we're at today, what do you believe is a sustainable or tolerable level of COVID transmission for the province, after this circuit breaker concludes?
Yeah, and it's a tough question. It has many variables. Has the variables on how much our healthcare system can sustain, what sort of numbers, because we don't just want our healthcare system to sustain the amount of COVID cases that are coming towards it. We want to have our healthcare system, functioning for non-COVID issues. So we need to get back to surgeries. We need to get back to diagnostic imaging, and the only way to do that is get these numbers down. And so it's time will tell what sort of level of transmission we can tolerate to be able to have our system functioning for everyone.
From CKDM Dauphin, Matt.
Good afternoon, Matt Hamill from CKDM News in Dauphin. My first question is for Dr. Roussin about the restrictions on gatherings at private residences. Can you help ease the mind of some Manitobans, as I know some people are unsure want to make sure they're acting within the rules when going to another home to care for a senior family member that needs assistance, maybe find it difficult to designate one family member to do so. Hoping you could clarify those rules and exemptions and help Manitobans feel confident they're not breaking the rules when managing those kind of situations.
And so this is, a challenging issue, and you'll note that, early on when we made these, started making these recommendations to socialize only within your household, we didn't put it into order because of these very reasons. Because now being black and white, there's going to be exclusions, and people need to start to figure out if they are in that exclusion, and some people are quite worried even though they have very good reasons. And so these are a challenge when you require black and white answers to these type of questions. Guidance is usually much better, but we had to go to black and white guidance or black and white orders. And so we have that exemption for health care, for caring of other individuals. And so we never wanted to exclude that. So if you have an ill neighbor or family member that you're there to provide assistance to, those are the type of things that we've exempted in the orders. The designated one person is really for people who live alone, who say don't really have a health issue per se that need health support, but we recognize that that person living alone should be able to benefit from at least having some face-to-face time with individual, and that's where that one person, that designated person, comes from. So again, people who are in need of assistance, that's not what these orders are about. These orders are really about socializing. We don't want people over at other households for the purposes of socializing. If you're there to provide support for someone, of course, we need the minimum amount of people there doing that. So it should be, if it's one person that's required to provide that support, that's who it should be. But the idea is to limit that socialization.
Thank you for that. My follow-up, I'll leave open to the both of you. The outbreak at the St. Paul's Care Home in Dauphin has been declared over today. This is one of those care homes which the province not reported any data on the number of cases there, still showing zeros across the board. Can you tell me why public health is unable to provide those case numbers with respect to, I guess, a handful of care homes in the province in this situation? And now that the care home outbreak at this particular care home in Dauphin is now declared over, do you think we can expect to get that information at some point?
Yeah, I can't think of a reason why we wouldn't be able to report on that. If somebody declared an outbreak, there's usually a reason. Sometimes what we found is that there may be a facility, a personal care home that's attached to another healthcare facility, where there is actually 0 cases in the personal care home, but because there was a case in a nearby facility or attached facility, out of an abundance of caution, we declared an outbreak in the PCH. So sometimes that can explain some of those zeros, but we'll try to look into that and see if we can get you some good information.
Thank you. We have time for a few more questions this afternoon. Please proceed.
Dr. Roussin, it's Steve Lambert from the Canadian Press. I'm going to try again on projections because, as you can sense, we in the media get a bit frustrated. We get projections after the fact when they're no longer really projections. So maybe in terms of intensive care capacity, can you tell me whether the most current projections project a full usage of the potential 173 beds over that number or under that number?
So what I can tell you there is that the original projections, that we are trending in sort of that worst case scenario did show that we were heading towards that, and as early as December. At the same time, we run the other 3 scenarios, and the most distinct one is very strict public health restrictions, which I would classify as this, with full adherence. And at those numbers, then absolutely we see a dramatic decline in numbers. We see a significant decline in hospital admissions, including ICU. And so it's hard to project where we are right now because we can't fully tell you which scenario we're on. We need more time to know what scenario we're on right now. We know we have high public health restrictions. We can't yet tell you what the adherence is, so which of those 4 curves we're landing on, it's too early.
Dr.
Dr.
Roussin,
Dr.
Roussin here. We've got this, as you mentioned. Go ahead.
Thanks. Are there supports available for frontline workers who have to isolate from their families?
Well, they certainly can stay in one of the hotel sites if they are either a contact or a positive COVID case. That would be referred through public health, and it would be an option available to them. As well, there is sick time that they could take and arrangements that have been made through the employer with the unions.
Dr. Roussin, furthermore about these low case numbers here, is the are you? I heard that you're going to be closing down Nairn. Is that true? And if are there any other testing sites that are going to be closed soon?
No, I'm not aware of any closures of testing sites.
So are these lower test numbers the result of people having fewer symptoms?
Yeah, it's hard to know. So we're seeing that our test volumes are a bit down. We're certainly seeing well over 2,000 tests a day, and sometimes that's getting up there. We have much more capacity than what's being done right now. The reason behind it is I can't say for sure. That's we'll have to see what the trend does.
So if capacity is down, then can anybody with a test, anybody who wants to have a test now, asymptomatic or symptomatic, can anyone now walk in and get a test?
Our guidance is symptomatic people only, unless you've been directed by public health.
Why, if your capacity is low?
None of this capacity is infinite. Right, so we want to use our capacity, whatever we have. There's still strains at the lab on a number of factors. Right, reagent is one common thing. So we want to use our finite resources to best we can. So if there's a increased demand because of people are symptomatic, we want to be able to meet that. Right now, we don't want to just use capacity just for the sake of using it.
Yeah, but why not use that capacity then in school? You have the extra capacity to do it. Why not use it in school to get a broader, more complete picture of if kids have it, even if it's asymptomatic? Why not use the extra capacity for to use the capacity because you have it instead of just sitting on it, I suppose.
Remember that this is just days right now that we're talking about, right? So we can't change our entire approach because we have a few days of lower test numbers. So we'll see where things go, and we're looking at various ways to use our capacity broadly, but we can't make quick decisions and overhaul our whole testing approach because we have some days of relatively lower testing numbers.
Thanks, everyone. This concludes our media briefing.